Heads up. If you're receiving Social Security, SSI, or SSDI, pause whatever you're doing and pay close attention to this right now. Millions of American retirees and benefit recipients just received word of some of the most consequential news in recent memory. And if you haven't caught wind of it yet, you may be missing out on significant financial support you're entitled to. Congress has recently enacted a groundbreaking piece of legislation that is having a direct effect on your Social Security benefits, SSI payments, and SSDI checks. And that's only the beginning. Additional financial relief is being made available, and there are particular groups of seniors who qualify for payments they haven't even been informed about yet. Could you be one of those people? Here's everything we've been able to confirm so far. Benefit amounts are being adjusted, payment schedules are undergoing updates, and countless seniors across the country are already asking, when will my payment arrive? What will the amount be? Is there anything I need to do in order to receive it? We have reviewed every page of this new law thoroughly so that you don't have to. Whether you're 62, 70, or somewhere in that range, whether you collect Social Security retirement, SSI, or SSDI, this video explains precisely what this means for your finances in clear, straightforward language. No complicated government terminology, no dancing around the subject, because you have every right to know the full truth about your money. If you'd like to ensure that every senior across America gets access to this crucial information, go ahead and tap that like button right now, and let's spread this news to every person who needs to hear it. Welcome back, friends. If this is your very first time joining us, you've come to exactly the right place. And I want you to understand that what we're going to cover today is something that every single individual receiving Social Security, SSI, or SSDI in this nation genuinely needs to hear. This is not a clickbait headline. This is not an overstatement. What Congress has recently done is real. It is significant, and it is going to have a direct and measurable effect on the money that lands in your bank account or shows up in your mailbox. So please get comfortable, settle in, and let's walk through every detail together because you deserve to fully understand what is happening with your benefits and the money you've worked so hard to earn. Now, before we dive into the specifics of what was just passed and what it means for you personally, I want to take a brief moment to acknowledge something important. A great many of you have been going through an incredibly difficult stretch financially. The price of groceries has increased, your energy bills have climbed higher, prescription medications cost significantly more than they once did. And for millions of seniors and disabled Americans who rely on Social Security as their primary or sole source of income, every single dollar carries a weight that most elected officials in Washington simply don't appreciate. So when news like this surfaces, news about possible increases, financial relief payments, and new legislative action, it is entirely understandable to feel a combination of hope and healthy skepticism. I completely understand that, and that is precisely why we are here today. To cut through all the confusion, present the facts in a clear and organized way, and help you truly grasp what this means for your everyday life. So let's begin at the very start. Congress has been facing substantial pressure for quite some time now, from advocacy organizations, from senior groups, from disability rights activists, and frankly from millions of everyday Americans who have been writing letters, making phone calls, and showing up at community town halls demanding meaningful change. The rising cost of living has been putting a squeeze on people with fixed incomes for years, and the calls for relief have become increasingly urgent with every passing month. And now, following extensive debate, negotiations, and pushback from multiple sides, a new piece of legislation has successfully made its way through Congress and has been signed into law. And what is contained within this law is going to matter tremendously to you personally. Let's begin with Social Security, since that is what the majority of people watching this video rely upon. The new law contains provisions that directly affect how Social Security benefits are calculated and adjusted going forward. One of the most significant elements of this legislation centers on something known as the Cost of Living Adjustment, or COLA. Most of you are already familiar with COLA. It is the yearly adjustment applied to Social Security benefits in an effort to keep pace with inflation. But here is the core problem that millions of seniors have been raising for decades. The method used to calculate COLA has never truly reflected the actual, real-world expenses that older Americans face on a daily basis. The current formula relies on something called the CPIW, which tracks the spending behaviors of urban wage earners and office workers. And here's the important point. That does not describe you. That does not represent the typical Social Security recipient. Seniors allocate a much larger share of their income to healthcare, prescription drugs, housing, and groceries. And those costs have been rising at a faster pace than the overall inflation rate for many years. What this new law does is take meaningful steps toward correcting that fundamental imbalance. The legislation includes language that works toward recalibrating how these adjustments are determined, placing greater emphasis on the actual spending patterns of people aged 62 and older. This is something advocacy organizations like the Senior Citizens League and AARP have been pursuing for literally decades. And while the complete shift to a new formula doesn't occur immediately, the direction is unmistakable and the intent is crystal clear. Your benefits should accurately reflect your actual costs, not the spending habits of a 35-year-old working a desk job in a major city. But that is only one component of what was passed. Let's now discuss something that has been generating an enormous amount of conversation and enthusiasm within our community: the financial relief payments. Now, I understand that the term financial relief brings back memories of the pandemic-era payments that were distributed in 2020 and 2021, and some of you are likely wondering whether this is similar to that. Here is what you need to know. These payments are targeted, meaning they are specifically intended to reach individuals who are on fixed incomes and who have been hit hardest by inflation and the rising cost of everyday necessities. And Social Security recipients, SSI recipients, and SSDI recipients are squarely among those this relief is designed to support. The specifics of how these payments will be structured and delivered are important to understand, so let's go through them carefully. For individuals currently receiving Social Security retirement benefits, the payment is designed to serve as a supplemental relief measure in addition to your regular monthly benefit. The Social Security Administration, which is the agency responsible for processing and delivering these payments, will be working from the information they already have on record for you. In most cases, you will not be required to take any action to receive this payment. If you are already enrolled in direct deposit, which describes the vast majority of Social Security recipients, the funds will be deposited directly into the same bank account where your regular monthly benefit is sent. If you receive a paper check will be printed and mailed to the address currently on file with the SSA. Now, for those of you receiving SSI, which stands for Supplemental Security Income, there are some particular points worth understanding. SSI recipients are among the most financially vulnerable individuals in the country. Many of you receive SSI because you are elderly with very limited income and assets, or because a disability prevents you from maintaining employment, and you do not have a sufficient work history to qualify for standard Social Security retirement. The new law specifically contains provisions to make certain that SSI recipients are not overlooked. The payment amounts for SSI recipients have been structured with consideration given to the lower baseline benefit levels that SSI provides compared to standard Social Security retirement. The relief is therefore proportional and genuinely meaningful. For SSDI recipients, that is Social Security Disability Insurance, the situation is equally important. Millions of Americans receive SSDI because they became disabled before reaching retirement age and are no longer able to work. Many of these individuals are managing life on very tight budgets, handling significant medical costs, and coping with conditions that make each day genuinely challenging. The legislation identifies SSDI recipients as a priority group for this relief, and the payment structure reflects that designation. If you are currently receiving SSDI, you should be watching for correspondence from the Social Security Administration in the coming weeks. They will be sending notifications by mail and through your online My Social Security account if you have already created one. Speaking of the My Social Security online account, if you haven't set one up yet, I want to strongly encourage you to do so. Visit ssa.gov and look for the option to create a My Social Security account. It is completely free, it is secure, and it provides you with direct access to your benefit details, your payment history, and any notices or updates that the SSA sends to you specifically. During a period like this, when important changes are being put into effect, having that direct channel of communication with the SSA is genuinely valuable. And if you're not comfortable doing it on your own, consider asking a trusted family member, a close friend, or even your local public library. Many libraries have staff members who are happy to assist seniors in setting up online accounts in a safe and supportive environment. Now, let's address something I know is on the minds of many of you, and that is the question of taxation. Specifically, are these financial relief payments going to be taxable? This is an extremely important question because for many seniors, even a modest increase in income can shift your situation when it comes to how much of your Social Security is subject to federal income tax. Under existing law, if your combined income surpasses certain thresholds, up to 85% of your Social Security benefits can be subject to taxation. Those thresholds are relatively modest and have not been revised in decades, which means a growing number of seniors have found themselves affected by this over the years, despite not being financially well off by any realistic standard. The encouraging news, based on the legislative language that has been reviewed, is that these targeted relief payments are structured in a manner that should not classify them as standard taxable income in the conventional sense. However, and I want to emphasize this clearly, you should absolutely consult with a qualified tax professional or reach out directly to the IRS to confirm how these payments will be treated in your individual tax situation. Please don't rely exclusively on what you hear online, including on this channel. Seek out personalized guidance from someone who has a complete picture of your financial circumstances. Now, let's turn to another component of this legislation that hasn't been receiving as much media coverage, but is frankly just as significant: the changes being made to the earnings limit for individuals between the ages of 62 and full retirement age who are still working while collecting Social Security. Under the previous rules, if you were drawing Social Security benefits before reaching your full retirement age and were still employed, your benefits could be temporarily reduced if your earnings surpassed a specific threshold. For many seniors who work part-time jobs to supplement their Social Security income, this has created a real and ongoing financial frustration. The new law raises that earnings ceiling substantially, which means you can earn more from employment without experiencing a reduction in your Social Security benefit. This is genuinely life-changing for the segment of our audience who find themselves in that particular situation. If you are 63, 64, or 65 years old and collecting Social Security while also working a part-time position to help cover your expenses, you now have considerably more financial flexibility. You can earn more, retain more of your benefit, and not find yourself constantly worried about accidentally triggering a benefit reduction. And while we are on the subject of working seniors, the law also contains provisions that strengthen protections against age-based discrimination in the workplace. Now, you might be wondering what workplace discrimination has to do with Social Security or relief payments. And the answer is that it has everything to do with it, because financial security for seniors is not limited to the checks that arrive from the government. It also involves the ability to continue contributing, working, and earning if you choose to do so and are capable of doing so. Strengthening protections for older workers means that if you are 68 years old and wish to remain employed, your employer cannot push you out simply on the basis of your age. That type of security provides people with options, and having options leads to improved financial outcomes overall. Let's now dedicate some time to discussing what this legislation means specifically for individuals living with disabilities. The disability community in America has been advocating for recognition and dignity for a very long time, and the SSDI provisions within this new law represent a meaningful acknowledgement of the unique and ongoing challenges that disabled Americans face. One of the most impactful changes involves something called the Substantial Gainful Activity Threshold, commonly referred to as SGA. The SGA is the amount of money you can earn through work each month before the Social Security Administration determines that you are no longer considered disabled for the purposes of your benefits. If your earnings exceed the SGA amount, your SSDI benefits can be discontinued. For years, this threshold has been set too low, creating a situation in which disabled Americans who want to attempt part-time work, even in a limited or occasional capacity, are gripped by fear of losing their benefits if their earnings edge even slightly over the limit. The new law raises the SGA threshold in a meaningful way, giving SSDI recipients more room to explore employment options, give back to their communities, and supplement their income without living under the constant anxiety of losing their healthcare coverage and disability benefits. This matters enormously for individuals managing conditions such as multiple sclerosis, lupus, heart disease, diabetes-related complications, and mental health challenges, People who may have some capacity to work on their better days, but cannot sustain full-time employment on a consistent basis. Providing these individuals with greater flexibility is not only sound public policy from a financial standpoint, it is compassionate policy, and it reflects a growing recognition within Congress that the old rigid rules were causing genuine harm to real people in difficult circumstances. Now, I also want to spend a few minutes discussing something that affects a large portion of our viewers: the relationship between Medicare and Social Security. As many of you are aware, if you receive Social Security and are also enrolled in Medicare Part B, which covers your physician visits and outpatient medical services, your Medicare Part B premium is typically deducted directly from your Social Security payment each month. And for many seniors, when the Medicare premium increases each year, it can consume most or even all of the COLA increase, leaving you with little or no actual growth in your net monthly benefit. This situation has been referred to as the hold harmless concern, and it has been a source of frustration for seniors and advocates alike for many years. The new law includes provisions designed to establish a stronger separation between Medicare premium increases and Social Security benefit increases, so that a rise in healthcare premiums cannot entirely cancel out a cost of living adjustment. This means that when your COLA increase is applied, you are more likely to actually see that improvement reflected in your monthly payment, rather than watching it disappear into an elevated Medicare premium. I also want to address some of the questions we've been receiving regarding Medicare prescription drug pricing, because this connects directly to the financial well-being of seniors and people receiving disability benefits. Many of you are dealing with the overwhelming cost of prescription medications. Some of you may be rationing your pills, skipping doses, or facing impossible decisions between purchasing medication and purchasing food. The new law builds upon earlier legislation to further expand the government's authority to negotiate drug prices directly with pharmaceutical manufacturers. This is a significant development. When Medicare negotiates pricing, the resulting savings flow directly to individuals enrolled in Medicare Part D, which is your prescription drug benefit plan. The range of medications now subject to negotiation has been expanded, and the savings for enrollees are anticipated to be meaningful, particularly for some of the most commonly prescribed drugs among seniors and people with disabilities, including medications used to treat heart disease, diabetes, and autoimmune disorders. Let's also take a moment to discuss something that doesn't receive enough attention, and that is the financial impact of caregiving on seniors and their families. Millions of older Americans are not only managing their own financial situations, they are also providing support to adult children, grandchildren, or other relatives. And on the other side of that equation, millions of seniors are themselves being cared for by family members who have scaled back their employment or reduced their working hours to take on that caregiving role. The new law includes modest but genuinely meaningful provisions to support family caregivers, including provisions that allow certain periods of unpaid caregiving to be factored into the Social Security benefit calculation formula. This is particularly significant for women, who have historically assumed the majority of caregiving responsibilities and have consequently ended up with lower Social Security benefits because those years of unpaid caregiving were never reflected in their earnings record. Any progress toward crediting caregiving is a step in the right direction, and advocates are hopeful that this provision will be broadened in future legislative efforts. Now, I want to be straightforward with you about something, because I believe you deserve full transparency above everything else. Not every element of this legislation is without its shortcomings. There are provisions that advocacy groups fought to have included that ultimately did not make it into the final version of the bill. There are benefit increases that certain organizations argued should have been larger and more substantial. There are people in particular circumstances, including certain categories of legal residents who are not citizens, certain public employees in specific states, and individuals in particular transitional situations with their benefits, who may not be fully covered by every provision within this law. The legislative process is inherently imperfect, and compromises are an unavoidable part of how laws get made. What was ultimately passed is genuinely meaningful and represents real forward progress, but it is not the end of the road. Advocates are already laying the groundwork for the next legislative push, and your voice, your letters, your phone calls, your votes will continue to carry enormous weight in determining what comes next. For those of you who are most concerned about timing, when exactly are these payments coming? When will these changes officially take effect? Here is what we know based on the implementation guidance that has been made available so far. The Social Security Administration has been instructed to implement the changes on an accelerated timeline. The supplemental payments are expected to begin going out within the next several weeks for those receiving direct deposit, with paper checks to follow on a staggered basis shortly thereafter. The benefit calculation adjustments, along with the revisions to the earnings limits and SGA thresholds, will take effect at the beginning of the next applicable benefit period, and the SSA is currently working to update its internal systems to reflect these changes. Notices will be sent to beneficiaries explaining the specific adjustments to their individual benefits and what they should expect going forward. If you have not received a payment or an official notice within the expected time frame, the most direct course of action is to contact the Social Security Administration directly. Their national toll-free phone number is 1-800-772-1213, and for TTY users, the number is 1-800-325-0778. They are available Monday through Friday, from 8 in the morning until 7 in the evening Eastern Time. You may also visit your nearest Social Security office in person, if that is the more comfortable option for you. And I recognize that for many of our viewers, having a face-to-face conversation is far more reassuring than handling things online or over the telephone. Both routes are available to you, and the SSA staff are there specifically to help you understand your individual situation and navigate these changes. There is one more topic I want to address before we wrap up today, and it is the very serious issue of scams. Friends, whenever news like this comes out, news about relief payments, news about benefit adjustments, news about money being released, scammers emerge immediately to take advantage of the situation. They deliberately target seniors. They will call your phone claiming to represent the Social Security Administration and tell you that you must verify your personal information in order to receive your payment. They will send emails containing links prompting you to click through and submit your Social Security number along with your banking details. In some cases, they will even appear at your front door. Please hear this clearly. The Social Security Administration will never contact you by phone and request your Social Security number. They will never ask you to pay any kind of fee in order to receive the benefits you are owed. They will never pressure you to verify your banking details by clicking a link in an email. If you receive any communication that follows that pattern, hang up immediately, delete it, and if you want to verify the actual status of your payments, call the official SSA phone number yourself, or go directly to ssa.gov by typing the address into your browser yourself. And please share this warning with your friends and family members. Scammers are counting on people being excited about incoming funds and letting their guard down as a result. Don't give them that opportunity. The key takeaway today, friends, is this. Congress has listened to the voices of millions of seniors and disabled Americans. And while the broader effort to secure full financial stability and dignity in retirement and disability is far from finished, what was just enacted represents real, tangible relief that is headed your way. Whether you receive Social Security Retirement, SSI, or SSDI, whether you are 65 or 85, whether you live in a major metropolitan area or a small rural community, these changes were designed with you in mind. Your benefits are going to more accurately reflect the real expenses you face each day. Your payments are going to include supplemental financial relief. Your ability to earn income from work without losing your benefits is being expanded. And your prescription medication costs are going to be addressed more aggressively than ever before. These are not minor adjustments. These are meaningful and substantive steps toward the kind of financial security and fundamental respect that every American who has contributed to this nation through a lifetime of work and dedication absolutely deserves. We will continue to provide you with updates as the implementation process moves forward, as payment dates are officially confirmed, and as any new developments come out of Washington. This is an ongoing story, and we are committed to staying on top of every single update for you because that is the entire reason we are here. You are not navigating this on your own. You have this community, you have one another, and you have this channel dedicated to delivering the facts, the details, and the practical real-world guidance that helps you get the most out of every dollar that is coming to you. Thank you so very much for joining us today. Take good care of yourselves, look after your neighbors, and we will see you in the very next video.